Hi, my name is Marc Moisi, and I'm the Director of Neurological Surgery and Complex and Minimally Invasive Spine here at the Hurley Neurological Center, the Mid-Michigan Center for Brain and Spine Disorders. I just wanted to tell you a little bit about our philosophy and what we do here at the Neurological Center. Back pain is one of the most common entities that a lot of primary care physicians or family practitioners may see in their office on a regular basis without a true pathway of what to do. And I am here to tell you that I want to partner up with you for your patients all the way from the beginning. I know sometimes it's difficult getting those insurances to agree to the MRIs. I will see those patients without scans. But I also want you to be rest assured that these patients are not going to be rushed to surgery. Quite the contrary. What I tell all patients that unless it's an emergency, that I will try to throw everything at them and not offer them any surgical intervention. Our normal neck and back patients, they need conservative management. And I'm here to be one of your partners to provide that conservative management for those patients in order to ensure that they get better and really enjoy their lives, both with their families and their normal activities. I always introduce myself and tell patients that if it's not an emergency, you're gonna have to convince me you need surgery. I'm never gonna have to convince you. I think this partnership of developing that relationship and that level of trust with those patients really is what differentiates myself and all my team members from all other physicians in the area. I coined the term multidisciplinary patient-centric spine care. I am very fortunate enough to be surrounded by a wonderful multidisciplinary team, and that's how we treat our patients. I want to meet the patient early on in the game. I am okay with having met a patient, even if they don't need much other than a physical therapy referral and perhaps a scan. I am okay realizing that as a clinician, especially primary care or family practice, you see a lot of patients with back pain and a lot of patients with neck pain. And it doesn't matter that if they need something or don't need something, I'm willing to partner up with you as early in the process as possible. And if they only need some supportive care, that's perfectly fine with me. We could provide them with the education that the patient needs and create that easy pathway for them to reach out to us should something change, either in the near future or distant future. I like to explain to patients that your spine surgeon is almost like a marriage. You want to make sure that it's the right person for you, and you also want to make sure that they have your best interests at heart. I also wanted to reach out to our radiation oncologists and our oncologists to know that we also take care of all spine oncological problems here at Hurley as well. I think one thing to note for my oncology and radiation oncology colleagues is I understand the urgency of seeing these patients in a timely fashion. If you have such a patient, please reach out to me directly and I will see that patient within a week. This is not something that could wait. It's a very difficult process, both for my colleagues as well as for the patients, and we respect that and we will see the patients right away. With our oncological care, I think it's very important to understand what modalities exist, whether it's from as complex as a reconstruction for solitary lesions or intradural lesions that need to be taken care of. In addition, we do understand that unfortunately there are these patients that require palliative care, and we're here to provide that to ensure that although it's difficult during end of life, that we could make it as pain-free and as comfortable for our difficult patients as well. I also want to let all our colleagues know that I do a lot of revision work, and I'm one of the revision surgeons in Michigan, especially in mid-Michigan and all of Michigan. I am not afraid of revision work. I know it's a little more difficult, but we are equipped with all the up-to-date tools here to revise and take care of these patients. Even when they feel like, no pun intended, their back is against the wall, we are here for you and for them. I think a very important aspect of revision spine surgery is there are some surgeons that do not feel comfortable doing it. And if that's the case, and the original surgeon does not feel comfortable taking care of the patient, I'm more than happy to see your patient and evaluate him or her to determine what the next appropriate steps are. I think another important aspect of what I do is neck and cervical spine, as well as thoracic spine care. I know we always group sciatica and lumbar radiculopathy in one, but the spine expands all the way up to the base of the skull. And there's many other entities that we could take care of here at the Neurological Center. One thing that's very important is for my ER physician colleagues, I take care of all traumas throughout the spine and as well as all neurotrauma. If you have a patient in your ER that you do not feel as though you have the appropriate subspecialist to take care of them, please reach out to us. We will take care of all your patients any time of day or night. I also want to reach out to my orthopedic colleagues. As I tell a lot of patients, it's sometimes very difficult to differentiate between a spine problem and an extremity problem. And the last thing I want to do is operate on a spine for a hip problem or vice versa. And I think we need to work hand in hand to ensure the best care possible for these patients and that their true symptoms and ailments are being treated, not one that's being masked by a more complex problem. Without a team mentality, we are only as good as our weakest link. And I truly believe that Hurley Neurological Center is now going to be one of the staple care institutions for Michigan.